NHS. Now, to a shocking revelation, really, the NHS has been hit by a rise in the number of floods and fires at its sites in the past year. Records of fires are up by a fifth, and the number of floods has increased by almost 60%. Why is this? The Liberal Democrats say these figures should act as a wake-up call for the government about the crumbling condition of our health service. Now, the former chair of the British Medical Association GPs Committee is with me. Thank you very much, Lawrence Buckman. Thank you for coming on the show. Lawrence, what is going on in our hospitals and our NHS buildings? This seems quite remarkable that we've seen such an uptick in both fires and floods.
Well, it's not that remarkable, and it's completely predictable. And it was the hot news 20 to 30 years ago when we told the government of the day that this was almost guaranteed to happen. If you don't spend money on maintenance, if you impose austerity on something that needs continuous improvement, you will end up with buildings that fall to bits, both in the community and in the hospital sector and in general practice. And the fact is we haven't spent much money on any of this. And so we're left with emergency repairs. And as a consequence, particularly when there's a storm, buildings will flood or fall over.
And when it comes to fires, are you saying that the buildings are particularly flammable because they're in such a poor state?
Well, a lot of them were built at times with materials that we wouldn't use now. And a lot of them don't have adequate fire safety because, again, the fire safety equipment is old and it needs to be updated. And much of it is fitted onto buildings that no longer will support it. Really, you need new modern buildings, but that's not realistic to expect that very quickly. But we do need a plan of maintenance, and that's been suspended for years. There's tiny amounts of maintenance only where crises occur. And indeed, there are many hospitals that are in crisis from buildings. And of course, when a building doesn't work properly, you can't deliver the service from within it. If you can't get people into an operating theatre because the walls are crumbling, then nobody's going to get operated on, which is going to increase waiting lists.
So, Lawrence, what are you saying here, really, that we need to knock down some of these hospitals and start again? Or could this just be a little bit of upkeep here and there?
It's a huge amount of upkeep. It needs a plan. It needs to be planned with the Treasury, so money is guaranteed and not used to take money away from patient care. It has to be separate money for managing estates. And that can be done gradually, but in a planned way. It's not just a bit of tinkering. We need a large amount of work. Knocking buildings down doesn't work.
And what I'm a bit confused here, and some of our viewers and listeners will be too, is that we have record levels of funding going into the NHS, going into the service, going into hospitals, going into pay packets, and yet, as you say, we have crumbling buildings. What's going on with this money?
Because the bulk of NHS expenditure is in its staff, because the NHS is its people, and to a slightly lesser extent, the amount of money we spend on treatments. When there was no treatment for particular illnesses, then you didn't spend any money on it. But now you do. And so there are costs that you can't anticipate. Nobody anticipates a pandemic, which is going to cost you a fortune. And all of these things mean that maintenance money gets taken and spent on other things. And that's gone on for many years now. So it's not a new thing. But as you see hospitals gradually denuded of money for this kind of thing, because it's all seen as one pot, and I believe that actually that's a bit old-fashioned now. We ought to be looking at buildings and NHS estate as a separate thing. But while you look at them as one thing, inevitably, you're going to take money to spend on patient care, to break down waiting lists, to recruit more doctors and nurses, to pay for expensive drugs. They're all competing for the same pot, and the wise arrangement would not include that.
And Lawrence, just your reaction. We were talking earlier about new statistics that show 88,000 or nearly 88,000 appointments have been cancelled just in the last week due to these ongoing junior strikes. We've got another week of strikes coming. What do you say to that?
I think that the parties concerned should get round the table. I think they're going to talk eventually. They might as well start talking now. And there's a lot to say, and it wouldn't be difficult to come to a solution for the juniors who are seriously underpaid without destroying the NHS's finances. It also wouldn't be that difficult to fulfil government agendas. Talking is what matters. Striking, well, I understand why they're doing it, but striking almost never generates the kind of money you get from talking.
Yeah, I guess one of the difficulties is that both sides are saying that they're ready to negotiate, ready to talk around the table, but it doesn't seem to come to a solution. Thank you very much for your time, Dr. Lawrence Buckman, former chair of the British Medical Association GPs Committee.